Hello, I'm Dr. Clint Sexton with Naperville Integrated Wellness, and I'm a functional medicine physician. Today I want to talk about health and disease, cause and effect, and how the various systems and organs of the body work together synergistically to result in this broad picture of health and well-being. So first of all, health is an effect. It's not a cause. So our bodies respond in the process in terms of making things that are more healthful occurring in the body or things that are more disease producing in the body based on what it's subjected to, which goes back to the choices we make. So this is when we start looking at the food we're eating, our nutritional status, looking at is the body getting enough vitamins and minerals, etc. Things such as rest, allowing the body to recuperate. So we're talking about sleep or physical activity. Our bodies are designed to move, to be physically active. And these are some of the core things to really look at and consider when you're trying to restore health to the body. So we put a lot of attention on the diet. A lot of the common things that we're looking at with diet are we're looking at foods that are contributing to inflammation in the body. Inflammation makes everything worse, okay, just that simple. But when we're talking about inflammation, we're going back to primarily how our immune system responds to the foods we're eating. So we may be looking at food sensitivities, food allergies, things of that nature. So in addition to inflammation, we'll be looking at things such as blood sugar and insulin levels and the impact that can have on our health. And insulin can lead to, excess insulin can lead to weight gain or inflammation and other hormonal problems. So really, we're really typically looking a lot at things like blood sugar and inflammation. Now there are other things too with regard to foods, such as organic, non-GMO, pesticides and herbicides and all those, but I'm not going to get into all that today. So then we also want to look at nutrition. So nutrients are things that your body has to have in order to function properly. So the human body requires a certain amount of zinc or a certain amount of vitamin C or vitamin A or magnesium or calcium. And so these are non-negotiable. The body has to have these, but we require them in different amounts, just depending on the nature of our body and the state that it's in, and as well as age and gender, etc. So food, nutrition, sleep. Now sleep's very important because this is when the body's resetting a lot of things, systems in the body and healing. And that's another really important factor. And the brain really requires sleep. If we don't get sleep, the main system, the main organ that suffers is the brain or the nervous system, which is one of our primary systems for regulating health and promoting health in the body. So another thing to be looking at is physical activity. So our physical activity, the requirements will be unique to different individuals based on age, other problems that may be going on with the body. But we want to move it. We want to challenge it a little bit. So these are the things we'll look at. Now these are all choices. These are all causes. So the food we're putting in our body, or the nutrients we're putting in the body itself, the sleep we're getting. I'm not saying we all. If we're having problems with sleep, it may be a more difficult decision to make or a choice to make, but it's something we have to look at, because if we're not able to sleep, then there's something else going on in the body. And then we're looking at physical activity, and it's something you need to do on a regular basis. Going to the gym once a month isn't going to cut it, okay? Or if you're in your 20s or 30s and you could do more and you're just walking a little bit, well, that's great. That's better than nothing, but your body could really use a little more of a push. So again, we're talking causes and effects. So these are choices. Those are the causes. The effects are what we experience, the results, and that's health or disease, depending on the different choices we're making. And then I like to look at the body as this. There's a saying is that the whole is greater than the sum of its parts. And so what we're looking at here is that when all the systems are working together and supporting each other in this way, we get this nice big nice picture of health and the body working well. So we can't look at these systems in isolation. We can't say, well, that system's only responsible for this much of my level of health. We can't make that determination. They're all necessary. They're all part of the whole. And when we have more systems going the right direction, creating health promoting activities and chemicals, etc., then we have a greater level of health. And so really everything we do that affects our body it matters. We can't say, well, I know that's not so good, but it doesn't really matter. I'm doing a lot of other things. Well, that's fine. But that is going to dictate the level of health that you experience. So the things we do matter. Everything matters. We're looking for the things that we can do correctly. Things that are going to promote health. And lots of times we don't know what that is. But that's where functional medicine comes into the picture here. We can help guide people in terms of making better decisions, creating better causes, resulting in a greater level of health. So this is more just sort of an attitude or a mindset perspective on looking at, hey, what are the things we can do to help get the body working better so you experience a greater level of health and well-being. So if you want some more details on this, check out the blog.